Hey, it's Dr. Greer here, and I want to go through some of the frequently asked questions about Botox and other neurotoxins. I also have a great blog post on this, which I will link to in comments, or you can find it at greerplastics.org /blog. And one of the common questions I get is, how often do I need to have Botox? And the answer is about every 3 to 4 months. When you've been getting it a little longer, the muscles begin to atrophy, which means to weaken. So it will last longer. And some neurotoxins seem to last longer than others. Dysport is known for lasting a little bit longer than Botox and Xeomin, but it's not a one and done treatment. Botox is a maintenance treatment, so you need to get it regularly. Now, Botox is one of those things like Xerox or Kleenex. We refer to it, but the actual brand of Botox is one of several available neurotoxins. Xeomin, Jeauveau, and Dysport are the other 3 neurotoxins that are on the market, FDA approved for cosmetic use, and they're all a form of botulinum toxin A. Myoblock, which is botulinum toxin B, is only approved for medical indications. They all work very similarly. They're taken up into the nerve synapse and they block the release of acetylcholine, which is the messenger between the nerve and the muscle. So when the nerve sends a signal to the muscle to move, the muscle doesn't get that. And the end result is freezing those muscles or paralyzing them, and that prevents dynamic rhytids, which are wrinkles that appear with motion when you raise your eyebrows, when you smile, when you squint. Static rhytids are the wrinkles that are still there etched in your skin at rest. And if you start getting neurotoxins before those develop, it will prevent them. How much you need completely depends on how frozen you like things, and also your individual anatomy. If you have a really high forehead, you're gonna need more. If you have very strong frown muscles, you'll probably need more. If you have a lot more crow's feet around your eyes, then you're gonna need more. So it's a very individualized treatment, and it's a little bit hard to tell you without seeing you in person, and then I can give an estimate. But most neurotoxins are priced by the unit. Botox is usually a little bit more than Dysport and Xeomin, so you can call around. I do recommend sticking with the same office though, because it takes a little while to get your treatment exactly right. And if you switch injectors all of the time, then you're not gonna get the absolute best results. Another question I get though is it okay to switch between products? The reps will tell you no. Obviously they have a vested interest in seeing you continue to use just their product. I switch between products in myself all of the time. I haven't really noticed a change in results or a long duration of effect, but it's not something I've studied either. I would say, and I tell my patients, it's generally okay to switch back and forth. And if you find one that you like the best, then stick with it. And then final frequently asked question I get is, why can't you lay down or work out after treatment? It takes about 90 minutes for the toxin to enter into the nerve cell. And until that's happened, it can migrate. And that's one of those reasons you may hear about people getting a droopy upper eyelid or a heavy brow after treatment. So by staying, fairly sedate, not laying down, not working out for about an hour and a half after treatment, you should be good to go. It will have been taken up into the nerve cell. If you have other questions about neurotoxins or anything plastic surgery, leave them in the comments. I always love ideas for future videos, and be sure to subscribe to our channel so you don't miss them. Have a great day.